really work on working the toes, and then I want you to,
Do the little
you know,
stretching.
just do a little bit of that. So now your guest is feeling a lot more relaxed. How's the steam going on?
Good.
So it will help to unblock all those sinuses.
Okay.
So
Good.
steam.
Are we gonna see something like inhalation or
Yeah.
something?
So you just
Introduce that.
while he's having a steam, you can do your breathing as you deep breathing. So you can just keep on having your deep breathing. We can have a guided one. So we're breath in, 2, 3, 4, and hold a little bit. 2, 3, 4, and breathe out. 2, 3, 4, hold it. 2, 3, 4, another one. In 3, 4, hold. 3, 4, breathe out. 3, 4, hold it. 3, 4, and last one. Breathe in. Hold. And out. Hold. And you can breathe normally. So if you want me to keep the steam on, just let me know. Okay? Is it doing all right there? It's good to have that. So I'm checking. Okay? So I'm actually doing my reciprocals. So you just open up. Are you cold?
No.
So here I can confirm to her. So you told me that your shoulders, okay, your neck is very painful. So I can check. So right here, so I can check her neck. She said it's painful. So if you put your 2 fingers right there, so it's painful. Any pain? Any pain?
No, like
Yeah.
it's pain.
So it's not really pain. So meaning to say it is a very deep pain
pain.
she is having. Okay. Any pain? Okay. So to confirm that one, because she's on top of the shoulder. So if you will gonna see, you see. So now you see the mark. Okay.
It's a little bit water
Yeah.
retention.
So water retention, right there.
Oh my
Yeah.
God.
Yeah.
Okay. And then her muscle there.
I need to
So
try.
her major tension is right here. So right there. So she is a perfect example of muscle imbalance. Okay. So right there is very soft. Okay. So it moves freely, but this one doesn't. Okay. This one doesn't. So it doesn't go. So she is a perfect example of fascia. Okay. So when you see fascia, so right there I can move it. All right. But this one here doesn't. So her fascia here is really tight there. So I cannot move. Yeah. Okay. So it means we focus to release on this area. This is where we do TBB. Right here. Right here.
So it's on the left side.
Yeah. So we focus on her left side. But then she feel it like all the way. Okay. Like all the back.
It's like inflammation having.
So that is additional of your
Payment.
additional
Assessment.
assessment.
Yeah.
Okay, so that is your confirmation of how she is feeling really.
Yeah.
Okay,
This
so
is,
before you do your
palpation.
cranial releases, what we can do is we can just really do to your so hook right there. Okay, this one here in the middle, and then now you hold that occiput and then you lift it up and you rotate. How does it feel, Denise? So clockwise, back to normal, and then counterclock. So we are opening the vagus nerves. Okay, so this is body talk. Yeah. So what we are doing is we are releasing the opening up the communication link. Okay. So this is, without doing this, you are actually doing a body talk. So we just kind of doing it in this way, but actually you are now doing that tapping, okay, but in a different way. This is more of spa setting, so that's your tapping with your spa setting. So you feel that, you know, like the nerves and everything. So she's already. So that's what we want, right? So you can see result immediately. Rocking. So that to show you, you can do it over the towel, but then if I want to show it to you now with the video, we could do it on the skin, okay? So I want you to see where is my hand. So this part of my hand, you
Heel of
see
your
her
hand.
spine, the heel of my hand will be here on the spine. So you start
Side of
on
the
T1
spine. Okay.
up to right there. So the side of the spine, so you will touch like this, and now I'm here, but my pressure is on the spine.
Side of the
So I'm having here, and now I'm rocking.
Rocking. Okay.
Okay, so I'm rocking. So you have to be really precise on this one with your rocking. How does it feel?
It's like
So
the
you
whole
can-
body is rocking.
Yeah, so you can repeat that. You see the difference now? The water retention is already gone, only that one. So you can do it on the other side. So spinal rocking. So if not, you can just do there, okay? But if you really want to be precise, you have to keep on the vertebra to vertebra. So you just simply rocking, no pressures whatsoever. Okay, that's spinal rocking. All right, that's your spinal rocking. So after your spinal rocking, we will gonna do shiatsu on your back. All right, working downwards. So very simple. We just do acupressure. So again, use the heel of your hand. So now if I'm here, I would be working from that side. So right here, and then. So open up. So with shiatsu, you have to keep your one hand.
So you
Press
press
down.
it, you press and pump, right?
No,
Press
just
only.
press. So you press and stretch out.
Press and
Yeah.
stretch.
So you press and stretch out.
Again, it's on the side of the spine.
Yeah. So this one is on that side. So if I will work on the other side, then I go to the other
Other
side.
side.
So if I will work there, then I have to move here, and then I have to go to the other side. So you feel the difference? Yeah. So this is easier, right?
Can you feel the level of the pain different in the both side?
Yeah.
Which side you feel more? Because this
Left.
is left.
Okay.
Yeah. Now she recognize her pain.
Yeah. Now she recognizes her pain.
Yeah.
She can feel now her pain.
Yeah.
So
It's not. It's not.
so shiatsu on the back. Okay. Now you will do your acupressure. So crisscross.
Yeah.
So you start there, and then you just press down.
Again, press.
Yeah. So I'm controlling my pressures here with her because it's fine. So you just go up to lower back. You don't go up. So I repeat that one. So because she's so tight here, so what I do is I would be more gentle. So I press there, and then now I open. You feel that stretch? And then you
Going
release.
up to the neck.
So the more deeper you want to go, you have to move a lot more slower. So right here, there, open up, and then you release. So you see her breathing, she's following me. So you can do just a couple of these one. So you're not pressing down, you are
Releasing.
holding it, locking it up, and then pushing it away from each other. So you do this one without oil, because with oil you cannot do this.
It will be slippery.
How does it feel here?
Right.
Okay, so that's your acupressures, and then now we will gonna go to oil. Okay, so to oil. You tell me if you feel cold. Okay. I'm having a long nails. You don't feel it? This is Manju is the one teach me for this one. Huh? She said you can work with long nails, no problem if you know how to. Okay, so now we will
How to
gonna
use
start
your
our
mind.
lomi lomi with a press right there. I miss this one, huh?
Wow. We all need this lami lami.
Press down. So this one is a little bit of a technique, because if you don't know how to do this, the guest will gonna feel the pain with all the bones. Then we do one. I miss doing this now. And then press. Come back up, no pressures. And then again. Stretch, release, go down with pressures. Trace this erector spinae. And then move down. Scoop up. Press.
So a little bit tension in your glutes as well, Denise?
Yeah.
Okay.
It's all on the back and then goes down.
So right there. Scoop up. Alright, so that's your second step of your lomi lomi. There. Scoop up and then hook.
Why this side I feel ticklish, the other side is not.
So that ticklish, if you're working with the PRT or positional release therapy, it actually means that's the problem area.
Really?
Yes.
It's ticklish.
Yes.
The other side is painful.
Yes.
Ticklish is the
So-
problem.
The ticklish is the problem.
What?
Ticklish is chronic and the pain
It's acute.
is acute.
See? Now you're learning.
Yeah.
Yeah, so that is actually your chronic pain.
The baby feel pain, that means acute.
And then we'll have
And
your...
that ticklish, you feel normal later and it feels numbs.
Then you do your bridging.
So that's the chronic one, the
Yep,
one
that's
that's
the
ticklish?
chronic
Yeah,
one.
ticklish is chronic.
Hmm.
that's a good
So you only
You hate
feel
it, right?
the acute. Okay. So what you're feeling is acute.
The
So
acute I can feel, that's the painful one. But the ticklish, I thought it's nothing. But that one is the chronic freeze.
This is what I have been feeling for a long year, and then I realize now that tickle is a problem.
yeah. So the tickle is the
It's not normal.
Okay. What's my next step after my lomi lomi? So this is where I could do now my shoulder works. So I could stretch that one down. Okay. So first of all, I will do my rotations. So you hold that one right there
Underneath, right?
underneath, palpate the bony part, so I will, and then
So it's the top of the scapula.
so this is where we do rotation. So this is now we are doing exercise without her.
Doing anything. This is sleep.
Yeah,
This
you
is Helen
sleep.
style.
Yeah, you sleep
Helen
and
style
it's-
exercise.
Yes.
Yeah.
Okay, so if I want to do specific thoracic, because she do there,
Right.
so it means I just move my hand to wherever the tension
Oh,
is.
okay, I understand
now- Her tension is right here,
Mhm.
exactly. So she has a tenderness here.
Right.
I will move my finger to that tenderness, and,
And then
I
you
will work again.
You mobilize the specific
Now I mobilize the specific, so I can go mobilize the
spots.
specific. So I can mobilize the specific. So right there. So I can just repeat that with a different area. I'm telling you, she can sleep. And she has
Because it's
exercise.
opening.
Oh, this is the lazy style of exercise.
Yes, I'm telling you, you have to pay for this.
Yeah, that's why. This is this is the 2000.
She's
Exercise. You exercise while you sleep. Wow.
Yes. So if I want to do a little bit more right here, so which is I will gonna do to the opposite side. Okay. So here she is okay now. Now I can feel it's loosen up. So now it's loosen up. So I can just come back that one. So if I want to do a little bit more of a massage on her scapula now. So
It's a lot of
when you are doing release with the rotations, you go to the area which is less tension. Don't
First.
start with the more tension.
Okay, because for her is left
So their tension is here, so I start here.
to the right side.
So you can work more in your shoulders if you want to. Okay. And then I could go a little bit more deeper, so this is where you're gonna work. So release all that.
Now I can see her scapula.
Yeah, she has a scapula. She has a nice scapula. Okay.
I didn't say it earlier.
So if I want to do a scapular stretch, like really deep to release a deep rooted tension there, you will have to do push that one out deeper. So this treatment, you have to listen to her breathing lightly there.
So exhale to
Yeah.
push
So-
right.
Yeah, so we are exercising her now.
Yeah. This is the area, Denise. Therapists will take a long time to learn because
Because they need to understand how the body is reacting, right?
yeah, at the same time they have to take care of their position, their posture,
Careful.
the breathing as
Remove
well.
that one. So, because she has a lot of tension there, then I will put that and I will gonna work with her
Okay, so
trapezius
you are
release enhancement technique. Okay.
so the hands is completely
Yes,
the arms
hands.
down.
Yeah, so I'm working with her traps. You see. So I squeeze the traps because this could be painful, but if you just focus on trapezius,
And this way I think we can work more on the serratus as well.
Yeah.
And the lats.
yeah, we can work on her serratus and lats here on. So I will work on her serratus and lats later. So at this point, if I want to, I could check. So this effleurage is actually checking her lat.
Lat.
Okay.
Yeah.
So her lat here is okay.
Yeah.
All right. But her serratus there is not. So I leave that one for her next session.
Next session. Okay. Because this is the good one,
Yeah.
right?
So this is the thing that we haven't done before. We just want to treat everything immediately. So
I'm very concerned of the
Yeah,
pins inside
so- right now we want to know what's inside of our treatment. So you can see already the balancing. You
Yeah.
see, lot
Yeah,
lesser
this
now.
is not
A lot
going
lesser
down.
now, but I haven't worked with it.
Mm.
Okay, so stretch that. Just very gentle. Always on the joint. Hook up. Hold the joint there. So it's, even if he's so big, it's very light. So palpate the joint there. Palpate the scapula. And now move both. So she's working, okay? She's doing it for me.
It's supposed not.
Yes, she's supposed not.
Okay, relax.
It's okay. I don't mind. She can help me, no problem.
Because this is the problem part and she don't want to.
So
So
she is
this is-
protecting herself. Okay?
This is where, Denise, you will understand you are compensating.
So her problem here, so that one, so you can feel right there in her joint immediately. I'm not treating lower back yet, okay?
Not yet.
I'm leaving that one.
Lower back, it's
Yeah.
a long
So
way to
I'm-
go.
Yeah, it's a long way to go. I just
Leave me.
I'm just treating the upper.
I'm very good in lower back. I like treating lower
What's the
back.
difference in treating the lower back?
So the lower back would be nice with the
It's a-
lump, no?
It's a big work. It's
She loves the lower back, no? Okay.
there's a lot of muscles to work on the lower back.
And then I can work a little bit more again. So you just do your normal kneading. You see, I haven't added my oil yet. Yeah. So with therapists, they just keep adding on.
Keep adding and then you
Yeah,
can-
until the guest is swimming in oil.
Yeah.
Wow.
So shouldn't be.
swimming in the water.
That's why nobody can
Yeah.
use AA oil, okay? Because they don't know how to use it.
Sometimes the guest come out is dripping oil.
Actually, the one who teach me how to use oil is one of a sports person, one of my client. He always like, Jaryn, a very, very small oil, okay? Don't put too many, okay? And I always do that. So, you see how her scapula is not moving?
Yeah.
Yeah? So you see how under is it?
Yeah.
Yeah? So that's imbalance, no?
Mm.
So, because her
A lot of
trapezius
muscles.
right there, her, you see? It doesn't, yeah? So it doesn't even move. So when you want to move that one, so you see she's locking up, okay? So I'm not, so it go a little
It's not going
slow
to the-
that. Yeah,
Pain?
No,
no, it's not.
I can feel little lumps inside.
Yeah, it's inside, you see? That's
Yeah,
inside.
Yeah.
So actually this one is very chronic.
Wow.
So if it's
Bump.
chronic, don't work too much. So release enhancement. Okay. So drop that.
It's already red.
Yeah,
Without
that's
working
why
too-
you cannot work too much
Yeah.
with that one. You don't want to.
This is where if you go to Chinese massage, then they start to dig.
Yeah, it's so painful.
Yeah.
They press,
Yeah,
but press the wrong area.
wrong area, and they really want to break this.
The
Yeah, nuts.
nut. Yeah,
Yeah.
the nut.
Yeah.
They
So-
forced to break the nut.
Yeah.
So breaking the nuts. So if it's chronic, it's like your example is like a door. You know, your gate which is very rusty, and you want to force that one to
Open.
open, then you break it completely. Okay, so supposed to be you do it slowly, slowly,
Yeah.
put a lubrication, close it.
Wake them up.
Yeah. So it's a process. Okay, it's a routine. You need to come back. So now I can feel lat. Okay, serratus.
Serratus.
So it's under her trapezius is okay, but her serratus is not. Okay, right there, top. See,
Oh.
now you can feel all of that. So her lat is okay. So it's all serratus right there. So it's all serratus. So her rib cage here actually. That's why she is
Yeah.
now pushing it like this one.
Yeah, I'm a little bit concerned about your breathing as well. I think if you do like at least 5 minutes breathing, Morning and evening before
So
you go
this
to
is
bed.
now
especially?
where your aroma breeze
Yeah.
comes, you know.
Mm.
So if you want to do that, so you have to learn a lot first before you can move into that breaking down. That's the next level. Yeah. So right now we just open up a little bit like this. That's okay. So the muscular by the neuroskeletal. So now she has scapula. Okay, so after your scapular stretch, so those are all your shoulder works. Okay, I can work on my bamboo massage.
Wow, Jerry, still. The
Yeah.
scapula.
She has a lot.
You have a scapular stabilization.
Yeah. So after your shoulders, you can do things. So you can do fanning first.
Oh, wow.
So fascial releases.
Bamboo loves meat.
So you
Oh,
can do a
wow.
long one, like fanning right there. So this is your
How does it
so you
feel?
should be careful
Right.
with that. Okay. Then, so if you want to work a little bit more specific, so meaty part,
Lower back. It's QL. Right?
yeah. So you see, I'm in the soft spot. Okay, I'm not on that ribs. I'm on the soft spot. I can work with the glutes,
Oh, that's nice.
so you can work with your bamboo. So this is. So just really rolling,
Right.
like.
That's the
So-
area don't always touch.
So if you want to go there, don't put a pressure. Just roll the
roll it.
skin. Okay. How does it feel?
Okay.
Yeah. So no pressure.
It's more working on the fascia.
Yeah. So it's more fascia. So if you want to work a little bit more here, so you just roll it on that soft spot. It's actually very nice. And then you can work
Oh, there.
a little bit more there. So here, you really have to know your anatomy because you cannot go
Very
over
little
that one.
small muscles there.
Then if you want to work a little bit more here, so you do there and you can go upper. Slimming. And then I can go to the other side to work on that a little bit more. We're in.
Jay, I think we can create some slimming treatment with this bamboo.
Oh yes, man, of course. So again, so now
Especially in the cellulite
because I
area.
work on her ticklish glutes, now I can feel here. So now it's shaping up. So right there now, her tension comes up here.
It's not going in, right?
Yeah, it's not going in. So now it's coming up. So release that fascia there. So careful of the spine. So you see, my bamboo is like
Yeah,
this.
lifting
I'm
one
just in
side.
the I'm
One
just
side.
in the erector spinae. So it's so you have to angle up. So here I can feel her fascia, like so tight. So you just have to. So it's not just putting oil and rubbing, okay? So you really have to
It
feel
has to be really good
precise.
amount, precise. Otherwise, it's too slippery.
So you cannot work with too much oil. You cannot work with very less oil. So you really just to be so precise with this. Now, you see, it's flattened. So because this one is bones, so really just okay. You can do that. Then I can do her lat and upper shoulders. Okay. So I can do final touch. So I could do, you know, just, you can move it that way, man. Like really one long. And then you can move it that way. Just really long effort. Yep. Okay. So that's your bamboo element in there. Work on the glutes. So here we can, if you want to work, we can just cover that one up and then we can work. So now you will do all your sacrum kneading, very simple.
Do you want
Now
me to
I
do it?
can feel the heat. Okay, so now you know where is chronic. Now you can feel it. You feel that now? Yeah, it's not there before. So now it's they
Going
are
down.
coming out into surface. So now she's feeling her glutes.
Ah,
So now you know where is it? Right there. See? So when you work with glutes, you do on that one, like really on the ligaments there. So therapists just really do like this, no? But you really have to work on that ligaments, very precise. And then outside of that sacrum,
there is a pain.
where left or right?
Right.
See,
Right.
yeah.
The tickle one.
So her pain is yeah, this one.
Yeah, because it's
her
right
tickle one,
and it's
yeah.
left. The top.
Yeah, the top reciprocals.
Yeah. Top is left. Lower is right.
Then you can work more on the glutes if you want to. So excuse me, okay.
Yeah.
So you can do all your kneading there. And then we can work kneading there. And then we
Glutes,
can
I work more
lift it up.
sideways. Otherwise, that will I'll be concerned about the privacy. So
Yeah, we can work. You know, if it's spa and they have nothing on, you know, you could always work more on that. So right there.
it's point, right?
Mhm. So
My glute is
nice.
fighting your fingers. By itself.
Okay.
My glute is alive.
So let's see what your other side of your glutes can give us, nah? So work with that glutes.
Hot.
Hot.
No, the glutes feel hot. Oh, this one no pain. Upper. But that one, upper one hurt.
And then you can knead that.
Awakening your Muladhara chakra as well. This one.
Very energizing you, nah?
Yeah. Your root chakra.
Okay, and then we can pull that one up. Is it phone?
I think so.
Okay.
It's your.
Oh,
Oh,
never
it's
mind.
Jay.
It's my brother.
Yeah.
Don't worry. We're gonna call later. And then I will work more on that ticklish one. Okay, so we'll see what the ticklish one is giving us. So So really work deep there, like under the sacrum. Oh my God. Yeah. Now,
Tension?
yeah.
Yeah,
It's
there,
okay.
I can feel it. Yeah, there.
So now finding it.
It's painful and good at the same time.
So now she feel the pain, okay?
Sweet pain.
So
And pain,
earlier
but good.
there is none.
But moving into sweet pain is better. No?
Okay, so we have your glutes. We work on your feriformis, meaning to say we can do that.
And this is when the client, most of the time, they sleep because it goes.
And then they will be, ow.
Yeah, some are out, some are sleep, snore.
And then you can work on that.
Oh, that
Oh, this one is, ow.
so good. You're having treatment and I'm feeling good. Because I do lots
So
of
that's your
glute exercise.
feriformis. Okay. So after our glutes, so if you have, you can actually work with bamboo again in the glute side if you really like want to work on that big one right there. So that one is,
The big bamboo or
yeah,
the small
no, no.
one?
Big.
Yeah, so really you can, so you bit more.
No, I think the clients will like this because usually the spa they don't spend time for this one.
Oh no, yeah. This
They
is why
don't.
this is different, you know. We want to bring
So,
different.
we want to
that nowhere is
Yeah.
available.
Fanning.
This is exclusive for
No, I
SCS.
think the male guests will really like to do this treatment because the male they do a lot of sports.
Yeah,
They-
especially
they
sports people, they
sports
like it.
people, yeah.
That's why I say it's favorite because I do a lot of glutes exercise, and especially nowadays, female. You know, all the ladies they want to have a sexy, big, firm glutes, and they do a lot
So
of
you can-
squat and barbell exercise. Now,
Push,
different.
pull it up. Okay.
But even like the people who do sports will like this. Even the lazy people will like this. Like
oh
Helen.
yeah.
Because you don't need to do anything and someone is moving your muscles.
Yeah.
for you.
Okay.
Exercising.
So that's how we do with our glutes. Okay. Then I can work with the other glutes. So you see how balanced now for only one treatment. So you can really expose more of your
Yeah. So
gluteum.
sideways is
Yeah.
always good.
Yeah.
Open one side.
My brother keep calling me now.
Maybe the pig is having baby.
Yeah, the pigs are. No, not just the pig. There is a complaint with it's legal job he is doing right now because somebody is. Okay. So if you rule, you are working with the fascia. You're actually moving that. What do you feel?
Nice. Relax. I feel the pain is slowly getting less.
Yeah, so it is deep because we're working with the fascia. So you're not just ruling it. So it's ruling
It's
that one.
comfy.
It's comfy,
Okay.
right?
Comfy.
Right, so we have just to finish it with fanning. Right there. Okay. Yeah. Oh. All right. One, and then you can just do your. So this is just really Swedish.
Swedish kneading.
So just finishing touches, really just looking at what's going on there. We can do our Lumi Lumi work. So my Lumi Lumi work here would be more stretch. finish that one with a nice lomi work. I miss this one. I miss doing this part, no? Okay. Oh, my brother will not stop. So to be able to do this smoothly, it will be a constant practice.
No divided mind. It's just practice, practice.
Yeah.
Okay. Connect. So
Now is it even, my back?
not exactly yet, so that's why, you know, we need more time to do this one. Huh?
But it's all about
It's finishing
after the
touch,
first treatment,
okay?
how you feel.
Alright, and then just so you can hold it again. Right there. So return her breathing, return my breathing too. How it feels?
Attention is less.
Or you can open it up a little bit. Okay. And then here, now you can use your. I miss this one, right?
It's still Hawaiian.
Yeah, still Hawaiian.
So you're combining Hawaiian
Yeah.
here
Yeah,
in this
still
treatment
Hawaiian here.
for opening.
Yeah, mostly I choose Hawaiian with our program, not the Swedish
It's
kind of.
easy for therapists to learn
Yeah.
the elbow,
Yeah.
the forearm.
So that's pretty much it. Then we can work deeper here. So you can work first
Side.
just fanning. Inside, so you can work. So fascial releases. Okay, and then you can work rolling. So these are big muscles, so fascial releases. So it's different, right, Denise?
Yeah.
Yeah, so
This
now
one has
a lot deeper.
painful. Just now when you
Yeah, so a lot deeper, but then
not painful.
Yeah.
Deeper but not,
not
painful.
painful.
Yeah.
Okay, so right there.
I think because the muscles are
If
relaxed, so it's not
you can do
fighting back.
sliding, but this is too painful.
Too
Okay,
painful, yeah.
so that's why you do rolling. So you press down and then you roll up. So you are working with fascia. You press down, you roll up. You press down, you roll up. Okay, but therapists we're gonna do this,
Yeah,
which is
so
very
that's
painful.
like
Oh,
Is that called?
yeah, no, that's painful. I'm not doing that. Okay, so
That's like a guasa.
yeah, so same
Oh,
thing here.
yeah.
So you just
that's
do
painful.
there. So when you work with the muscles, you will. So my muscle is like this one here.
And you
I
stand
put
in the middle,
and then
and
now
then do the fanning.
and then do the fanning. Yeah, perfect. Fanning, right? Nice. So I can do. So you see that is bony part. So I have to do out a little bit, and now I just
That's nice.
have to
Otherwise
do.
you're gonna hit the bone.
Yeah. Otherwise you're gonna hit the bone. So a lot of anatomy here. So
So
here you only can go up to here.
What I was thinking,
okay?
because you were
So-
wearing the high boot yesterday.
Yeah.
Yeah.
So only
That's why you
there.
caught muscles,
Okay.
right?
So not on the. Even if she do like that, if that kind of, I'm happy with that. Okay, fantastic.
told you when you massage the other side of my leg, somewhere near the ankle.
Mm-hmm.
Wow, so nice.
Ankle, right?
Somewhere
Yeah.
near the ankle.
Yeah,
Just
it's
shake
it's
it.
quite a
Okay.
congested
Shake it.
there.
Shake it. Okay. So the leg releases that she wants is you can just really
Mm-hmm.
completely do that. That's your TBB. Then if you want to double check. So now, free,
Mm-hmm.
right? That's her sauce. Yay! Okay, perfect. Reciprocals. So, middle of the leg.
Oh, that's very
Inner thigh.
That's
Yeah.
nice of it.
So it's
Oh, just now when you
AD
press-
ductor muscles, and then the calf.
Ankles. Alright, so
Ankles.
hold that one right there. That's reciprocals. So you can go to the other side or you can just stay here and then you hold that one and then now I'm pushing. So this one needs a lot of practice before you can
Yeah,
make
you
that
don't wanna
feeling.
hurt.
Okay?
Yeah.
The connection,
stretch-
the
the
touch,
stretching.
and so many things.
Otherwise, I would be on the other side really.
Yeah.
But I can just do that. Now you can feel it's opening, right? So, right there. So that is your shiatsu. Then with the leg raise, so we just
This is where are you gonna apply the PNF?
yeah. Now this one just leg raises. So you contact ASIS and then you can
ASIS,
just-
right?
Yeah. Right there.
ASIS. What's ASIS?
So
That
PSIS is posterior superior
iliac
iliac
spine.
spine,
iliac spine.
and the anterior
ASIS anterior
superior
iliac spine.
Because I heard that one and I think I had that in my exam, but I completely forgot what's
So
that.
that's why
Superior because
in
it's
this
tougher.
one it doesn't matter if they have all my protocol.
Yeah.
They cannot interpret my protocol if they don't have a TBB. They don't have body talk, and they don't have fitness.
A lot of anatomy knowledge.
This one is all. So men will gonna love this,
I'm
okay?
gonna do the same
Because
thing.
we will have.
That's ticklish and painful at the same time. How
So-
come?
Or I can do bamboo here. So
Anything
We
will be
start with this
ticklish
one.
for me as well.
this is energizing, okay? So we want them to
Painful.
scream.
So we want client to wake up.
Yeah, we want you to scream with this one. This is the idea.
I pay you to hurt me. Wow.
But it's good, right?
Yeah.
So now,
After the pain is like after giving birth and then it's finished.
yeah, we can use the bamboo here.
So
So
yeah, we can use bamboo,
Yeah,
and
we can
if
use
the
that.
client is really relaxing sleeping,
Okay.
we can do it differently
Yeah,
as
yeah,
well.
we can
So
do it
we do like Hawaiian, like using the forearms,
Yeah.
more relaxing.
We, we can do a lot.
This is where
Okay.
the therapist,
So,
they
that's
can
when they-
change.
yeah,
They can adjust.
because
yeah.
the therapies have to be changed. So I know you're painful. If I am working with you and not protocol, I will not do that. Okay? Because I know you are in pain. So if I am working with you, I will do this.
Yeah, that one is not painful.
Okay? Why is that? Because I'm shortening your TFL. Alright?
Yes.
It's not just because that, because I'm shortening your TFL. So, and then I will be doing your lymphatics.
Yeah.
Because when I do my shiatsu earlier, you said, okay? So it means you're in pain there, and I know you have lymphatic, so I'm changing my protocol. Okay? But of course, because it's not me, I'm teaching protocol, then they will follow my
Yeah, they
protocol.
exactly.
Yeah.
Yeah.
So,
they,
if I
what
am,
they need,
yeah.
basically what they
So-
need to learn is how to adjust.
yeah.
Adjust.
So if I'm now, because
to
with
find
you,
the problem.
I will work with you on a shortened
Mm.
muscles. So instead of doing that with your legs straight, I will gonna do this. So now you're not screaming.
Mm.
Okay? Because I'm loving you. Huh?
Yeah.
Yeah.
Just
So-
now you want to torture me.
Okay. So you see, if they just only do protocol, that's
Yeah,
completely different,
painful,
right?
yeah.
So
now,
they will have a complaint,
So,
and then they will
you see,
later complain.
it's not painful anymore.
Yeah.
Oh, this is
Yeah.
in the
Yeah.
protocol. Yeah,
this
they will
is-
complain. This is in the protocol because they cannot change with a different case.
So you see modification and all that. So if you want me to be me, you need time with me.
Yeah.
Otherwise, well, if you don't want to, fine. I'll do it myself then. Market it somewhere.
This is where Ganga actually, I think, she convinced the boss to have at least 3 months training. That was already 2 months because they were like 2-3 years experience therapy. So not all the area they need to be trained. So 1 month we finish everything. So they just need the client to practice, because you train in 1 month everything they understand, but that doesn't mean they're
They
already
know, yeah.
because they have to work with a different
Try,
body.
Yeah.
So after all this one, okay, like all your Swedish, so you can do all your pressure points right there, pressure points right there, you know, ankles, pressure points there, pressure points there. Okay, you can do all of your work here. These are all your Swedish things. Okay, you can do all your rotations right there, rotations right there. Now, with your P and F,
Start.
stretch with the hamstrings. How will we do that? Okay.
Dorsiflexion.
So we can do just this, and she push me.
Yeah.
Can be done, right?
Yeah, even she's sleeping
Yeah.
that she's
So-
pushing because you are doing dorsiflexion.
I can say push me, push my, yeah. So that one, that's already a P and F. Okay. How do you feel with that one?
Okay.
So,
It's not
Okay.
strenuous,
Yeah.
but
yeah,
it's
yeah. So can you
it's
push me?
reflexive.
Alright.
Yeah.
Or I could say, okay, straight your leg, don't let me move you. Okay? So now you have to, there. So you don't let me move you. Right there. Now you understand when I say, don't let me move you. So don't let me move you. Now if I say, don't let me move you, and I'm doing this.
And I'm fighting back.
Yeah, you see you're fighting back. So you
Yeah.
see, you feel that one?
Mm.
Yeah.
The deeper.
Yeah.
Yeah.
So don't let me move you. There. Now that's P and F. Okay. So actually it is very easy.
This one is interactive treatment.
Yeah, it's interactive. Okay. So this is where we're doing interactive.
Isn't it?
PNF works with a very deeper level.
Yeah.
Yeah. And
'Cause
it
you're-
does a lot.
you're-
Neuromusculoskeletal ligamentous. Neuroskeletal. Neuromusculoskeletal ligamentous.
Yeah.
That is ligaments, okay?
That's
So
lig-
this rocking, what am I loosening up is your ligaments right there in your
Muscles.
hip joint,
Oh, hip
okay?
joint.
So it's not just an easy, it's not
My
just,
legs
oh,
are
she's
tired. I
doing.
can feel
So-
now when you're moving.
Yeah,
I
so
can feel
right
it.
there.
It's going
Okay.
somewhere. Like when you're rocking it, the
Because this is
feeling is not on
neuromuscular,
the leg. It's
Yeah,
coming
it's
from
on the hip.
on the hip. Yeah.
not only on the hip, it's including your neck.
Neck. All the whole spine.
Yeah, so it's the whole spine. So if you do it consciously, so if I do it consciously, like really, I can tell where I am moving. Okay, so if I do this, I'm moving here. Nah? So if I want to move up there, right there. So you see? Yeah. So you can feel that's up to your neck. I'm
Yeah.
moving up to your neck, right that. Yeah, so so if I stretch here, I will have level. I can stretch here, I can stretch mid back, I can stretch upper back. So you see your problem is on your neck. So if I will stretch your neck, that's neck. See?
Yeah.
Okay? So if I want to stretch here, there. Yeah, so there are levels. So if I want to really just do protocol, yeah. So, but it's nice, okay? Because it's a surprise for you. You wake up, alright? So
You're
actually-
almost.
yeah. So you,
I don't want that
so
one.
that one, and then I will just say, oh, okay, all right. So we'll do it differently, okay? So now it's loving.
It's like you brutalize me first and then you tell me you love me. That's not nice. Oh.
So it means she has a lot of water retention.
Yeah, I can
Okay.
feel that there.
So the next time
Lymph.
around, she will not ask me to have a strong treatment. Oh, it means I will just do a lymphatic to you then. So now I'm doing this. Now she understands what's the difference of a lymphatic
Yeah.
and the other treatment. Because lymphatic, that's how I will gonna do. Oh.
That's why when I explain, because I know what is lymphatic, and I explain to the guests the feeling.
Mhm.
But when they come out, it's not what they expect, because what I explain they can picture in their head, but the therapist did not do that.
Painful one because they believe in pain.
Yeah.
So that's why do
Not
it pain
even
first.
Not pain, but even Aurora is too light, right? You cannot feel nothing. That one, something like that. It's just like rub, when you rub the baby to sleep like this.
So
Yeah.
can you imagine, when you are stretching it, you're not just stretching, you are just. So, can you just teach that to someone else? No? Oh, with Manju, she will gonna steal that immediately. So static pressures. So you can incorporate bamboo, you can incorporate things, anything here. No problem. So this is what we will gonna be doing. I think I have to adjust my 90 minutes. So probably this one, I will just do bamboo only on the back,
Yeah.
not on the legs.
Yeah, only in the problem area probably.
Yeah, only in problem area. Or just simply back
Yeah.
on the big muscles.
Mm.
We can just
That was nice actually. The big massage on the back.
Yeah.
It's not
yeah,
painful.
cannot
but feels
be on
deep.
the front of the legs, this one, the bamboo.
Yeah.
Because in the bamboo,
It's too
it's
sensitive.
too sensitive. You will just
Scream.
so that's why I changed this one into a normal Swedish only. This one.
Yeah, also because of the time and everything.
Yeah,
Yeah,
in
because of the time.
so I will have to choose my moves here.
You see, this
Because
is the
supposed to be she's not energizing yet. She will be in opening first.
Yeah.
Okay?
But today, now you did energize
Yeah.
part.
Excited.
See, this is the difference with therapists with experience and without experience. If they do 90 minutes, they already feel it's too long, they can't do anymore. But the therapist with the experience, because they know very well what to do, how to do,
Yeah.
how to treat, then even you give them 2 hours treatment, it's not enough.
Next time.
And
Yeah.
can you please straight your neck? Okay? Don't let me move you. Okay, one more. Okay, good. Don't let me move you. One more.
My left side is weak.
One more time. Okay. Perfect. So in your fitness, you do 5 to 6. In TBB, we do muscle energy technique. We do up to 8 seconds, 8 to 10 seconds in muscle energy technique.
Ah, okay.
So that's the difference.
Because
So if I want to open that one
Yeah.
up, so this one. This is just only for you. It's not protocol, okay? Because it is locked. There. To talk. I don't know if I'm in protocol now, man, but here we don't have much to do now. It's now Swedish massage. But my Swedish is not simple here. Okay. I'm working on her scaliness. I'm working now on her upper traps. So I'm working on her really cervical right there. So I'm loosening up her cervical there.
That's a good one.
So my kneading is, on the cervical spine. So you can feel. So client can feel right there. Yeah. So now it's loosening up.
That's cervical, that means.
Yeah. So it means
My left side, my
Her
left side.
cervicals. I can work with her scaliness. It's really deep. So you see, I'm right here. I put her angle like this one. So I'm actually, this is actually not simple, okay? Because I'm holding her neck.
Oh, yeah,
I'm
you're going
controlling.
deeper to the
I'm
other side.
controlling that one with the other side. I actually
Okay.
want to go in deep, so I will use this part. So you see, I'm right here. I'm holding. I'm supporting her neck, and then you see. So I'm not pushing my finger there.
It's
I
easy.
am pushing her own body. So I'm, you see? So that's the difference. So I'm bending her.
Yeah.
Actually, I'm bending.
Yeah.
Okay.
Side to side,
Yeah.
lateral.
So, yeah. So lateral, whatever. So we can label all that strict lateral bending to the.
Lateral side.
You know why there is nobody can interpret AA treatment? Because it's all written in anatomy. Cranial pressures, spinal pressures. Opening,
Science with the nature,
Yeah.
right?
science with the nature.
Yes.
So, you see.
Science with ancient.
Wow. So if I want to add a
Ritual.
little bit of shaking there, so
This type.
so vibration, so a little bit. So this is sports massage, so by sports. But you have to be really confident before you can do that. So now, right there. So
Yeah.
that's a lot of. See now.
The most hardest training, and then must long.
I can
If
do
you
her
know how to work
mastoid
there,
process.
Whole body will be
Yes, so I
relaxed.
can do her mastoid process.
Mastoid.
Yeah, so right there.
And this is the
Keep it
marma
straight.
point as well.
Okay.
One of the marma points.
So I can do her. I can shorten her sternocleidomastoid. So I'm shortening. Okay. So I will double check.
Okay. By
Now I can
lifting
dip.
that part, right?
Yeah,
You're
I'm lifting
shortening,
that.
okay.
So you see, I
Yeah, I'm doing
angle,
this as well.
okay, and then shortening.
Yeah, I'm doing this.
Yeah. So you can understand me.
Yeah.
So imagine somebody without.
Because I feel
So
good.
massage here you can.
Lateral side bend. Lateral bend.
Right there. And then I can, but I will not teach PNF on the neck.
Yeah.
But then if I will do a
It's good to
PNF on,
do so.
if I can do PNF or her neck, so her tensions is right here. So I have to side bend her a little bit, right there. And now I will ask her, don't let me move you. Okay, so don't let me move you, stay. And then I will push that one up. So I double check. Now better. Okay, now better. So how does it feel? Now better. Okay, so there.
Definitely on the
So
left.
now I can have her occiput, and her occiput is just now giving way. So you can do your normal pressure points, your normal.
You don't want to get up right now?
Yeah.
No, yeah.
So you can add your marma points on the face, which is that one. Okay. So if they add more money,
Yeah.
and more time,
A lot of more money. So this treatment started.
a lot of more money,
5 o'clock.
a lot of more time.
Yeah. It's already 7.
So right there. Okay.
Probably why I got all my migraines or something.
Did your migraine go away?
Yeah. Oh, like 3 days ago I had migraine. I drank medicine for like 2-3 days. Still didn't go away.
It's like seeing this movement with AA. I'm like, okay. For them, this is just a simple press, press, press. But actually, this is not a simple press, press, press. So if I want to do a TBB here, actually I could hook up and actually I can move her frontal. So craniosacral, so actually I can move the frontal here. So you can do whatever it is your pressure points, you can all add rocking movement into it. So you are actually moving the bony part. But then therapy is only press release, right? So craniosacral, I can just simply do that one, huh? Because she has very tight here. It seems like she is now, it's shortened, it's like this, right? So if I want to release this one, I just have to rotate. So this one I can do in opening, or I can do this one in awakening. Yeah. So energizing is mostly on all that. I have to review all my treatments now. Do your parietal, so craniosacral with this one, with AADRC lifting, but actually you move like along. Okay, temporal. And then your occipital. That's better. Okay, so we'll just finish it. Final head hold. This is my favorite. Final head hold. Afterwards, check on your thoracic. Down, so you finish it with. And then traction. So with body talk, you need to save whatever it is that we have done. So how you can do that is you squeeze that. So we do cranial bolt hold.
Okay, so the base of the skull.
Yeah. So now neutral. Squeeze the occiput. 10 seconds. Or listen to the breathing.
This is craniosacral.
This is craniosacral. You see, her breathing is going down already. See, she's so deep now in her root chakra. So you can do listening here if you want to. You can stay a little longer if you want to. So for her, her mouse is very active. So I will hold this one until it will stop a little bit because she's really active. That's why she can't sleep. So her
To work on the
yeah.
parasympathetic
Yes.
system.
Yes, so we have to work on her parasympathetic. So right there. So now it stops.
Not the fight, flight.
No. So right. So it's not just a simple head hold. So you know when you interpret their head hold. So actually it's more than that. And now I can just. So it's not as simple like that. So actually now I am connecting. So I'm finishing my treatment with my sternum
Crown
and
to
my
heart.
crown to heart.
Yeah.
So I'm saving everything. The body saves it,